Hello, I'm Pat Moyer. Tonight, a special edition of Impact, a panel discussion about the proposal to add fluoride to Wichita water. We'll hear from representatives of both sides of the issue, straight ahead on Impact. In August, the Wichita City Council decided to put the fluoride issue to a public vote. The question on the ballot November 6th will ask citizens of Wichita to authorize the Public Works Director to increase the level of fluoride in the drinking water supply to, quote, the optimal levels beneficial to reduce tooth decay and promote good oral health as recommended by the Kansas Department of Health and Environment. Now, this isn't intended to be a debate, but rather a discussion, allowing those with differing perspectives to articulate their views. Representing Wichitans for Healthy Teeth in favor of fluoridation, Pamela Ammar, a Wichita attorney and treasurer for the group, and Dr. Rob Dakin, local dentist. Representing those opposed to fluoridating our water supply, Dr. Stephen Lamadou of Advanced Alternatives for Health, and Dr. Charles Hinshaw, the director of the Bio Center Laboratory at the Reardon Clinic. We're going to begin with opening statements from each group to outline and frame the issue. Earlier, we used a coin toss to determine that Dr. Lamadou would make the first statement. And between Dr. Lamadou and Dr. Hinshaw, you have 4 minutes, and I'll ask you to start right now.
Thank you, Pat. Fluoride is the only chemical added to drinking water for the sole purpose of medication, for the assumed benefit of reducing tooth decay. Is it ethical to medicate entire communities without individuals giving their consent or without an individualized diagnosis, treatment, and follow-up? Voting no protects fundamental rights to freedom of choice to preserve these important public health protections and established by our medical system. The chemical to be used in fluoridation is not a naturally occurring fluoride that dentists use or that is found in toothpaste. The chemical used for most fluoridation applications is fluorosilicic acid, a toxic industrial hazardous waste produced by the phosphate fertilizer industry. This chemical was at one time discharged into the air, killing cattle and wildlife and polluting our rivers and lakes. This toxic hazardous waste byproduct is now collected from wet scrubbers of phosphate rock processing plants and is instead discharged into our municipal water system. Dr. William Hersey, chemist for the EPA headquarters, had this to say: if this stuff gets out into the air, it's a pollutant. If it gets into the river, it's a pollutant. If it gets into the lake, it's a pollutant. If it goes straight into our drinking water system, it's not a pollutant. That's amazing. Go ahead.
The purpose of this discussion is to educate the citizens of Sedgwick County about fluoridated water. My studies as a former proponent of fluoridated water have led me to believe that fluoridation is ineffective, unsafe, and expensive, and a medication without a prescription. Consider, fluoridated water is especially unsafe for babies and lower-income citizens. In November 2006, the American Dental Association advised that parents should avoid giving babies fluoridated water because of the high risk of developing dental fluorosis, a permanent cosmetic and structural defect. The most recent data from the CDC shows that 41% of American adolescents now have fluorosis, and that in fluoridated communities, the rates of decay and fluorosis are higher among the economically challenged, especially noted in the Black and Latino populations. Prominent leaders of the Black community who now oppose water fluoridation include Andrew Young, former mayor of Atlanta, Georgia, and former United States ambassador to the United Nations. Includes Pastor Gerald Durley of the Atlanta Baptist Church. I couldn't resist mentioning his name because he was born in Wichita. And the daughter of Martin Luther King Jr. and her cousin are also publicly fighting against fluoridation. Now, consider the efficacy and risk of fluoridation. Efficacy. The CDC, in sworn testimony before a congressional hearing, admitted that, quote, no laboratory study has ever shown that fluoridated drinking water in concentrations ranging from 0.7 to 2.0 parts per million has ever been shown to be effective in reducing decay. Never. John Rogers, Chief Dental Officer of the British Ministry of Health, stated in writing, quote, "There are no epidemiological studies on humans showing that fluoridation reduces tooth decay that would meet the minimum requirements of scientific objectivity." The York Review found that out of over 3,000 published studies of fluoridated water, not a single one met their criteria for scientific validity, and that only 25 published papers were found that met at least one of 3 less stringent criteria. World Health Organization data shows identical declines of tooth decay in fluoridated and non-fluoridated countries worldwide. Regarding risk, a special blue ribbon committee of the National Research Council, chaired by John Dewell, Emeritus Professor and Chairman of the Department of Pharmacology and Toxicology at the University of Kansas Medical Center, in an exhaustive review of published scientific studies, found no evidence, none, supporting the contention that fluoridated water is safe for public consumption. So is my time up?
Yeah, we've given you a little
I'll
extra
quit.
time. Okay, you're good with that. If
I'll
you
get
need a little
back
extra
to
time, we can give you up to 5
How
minutes.
much over did
Thank
I
you,
go?
Mr. Moyer. I appreciate that.
Dr. Dakin.
Wichita has faced an oral health crisis for decades. We have recently been confronted with a study by the Bureau of Oral Health that Wichita children, 58% of Wichita children have tooth decay. This makes Wichita the highest area and the worst in our state. Areas that have higher fluoridation have much less tooth decay. Decay is a serious problem for all ages. Children and adults alike are constantly having pain issues, infection issues, and also just the loss of school for the kids and the loss of work for the parents, as well as not being able to eat as well. Last year, more than 3,200 people went to Via Christi Hospital's emergency rooms for non-trauma related dental decay. And the problem with that is we as taxpayers pay that, because 4 out of the 5 people that go to the emergency room for those type of problems have they're on Kansas's Medicaid or they are uninsured. So we as Wichitans are already paying for that. I was born and raised in Wichita. I decided I wanted to be a dentist when I was a junior at North High. I studied hard through Wichita State University and University of Missouri, Kansas City. And I love what I do. I've never had a regret for being a dentist. But one of the things that I've come to realize that there is not a dentist in the world, including myself, that enjoys putting a filling in a 3-year-old child. Children are very susceptible to decay in areas that don't have access to fluoridated toothpaste, in good diet. And so that's why we were trying to promote bringing the fluoride up to optimal levels. Many times when a child has to be given dental treatment for decay, restraints are needed, sedation is needed, and that traumatizes the child for the rest of their lives, as well as the patient. The very worst part of all of this is that this pain and suffering can be avoided. We can prevent it. We know how to prevent tooth decay through brushing, flossing, proper diet, visiting the dentist, on a regular basis. We know how to stop that. So what can we do to make it better? Well, the Center for Disease Control and Prevention said that fluoridation, water fluoridation, is one of the greatest health initiatives in the 20th century. We've got over 3,000 studies that show that fluoridation in optimal levels is safe, effective, and cost efficient. So with that, what we are trying to do is we're trying to raise the level from the already naturally occurring fluoride. Every Wichitan is actually drinking fluoride right now, whether they knew it or not. The level is 0.3 parts per million. So what we're trying to do is just raise it up to 0.7 parts per million, which is the optimal level for fighting tooth decay. And that's recommended by the CDC. So when we talk about all of the different organizations that are behind fluoridation, I really don't have time to go through all of the agencies and organizations, administrations and that actually back up fluoridation as being a cost-effective way of doing these. The puzzling thing is that almost 75% of Americans are already enjoying the benefits of fluoridated water. And we in Wichita, we're the largest city in the United States that has not yet fluoridated the water. Now, our city leaders are so often trying to make Wichita have an image of being, up front, and I'm excited about that. And the city of Wichita is working hard to do so many things for us, but in this regard, in trying to do the most optimal way to get better health, we're not putting our best foot forward. And so one of the things that we want to do is just promote to people, who are you going to trust? Who are you going to put out there is it going to be the dentists, the physicians who are dedicating their lives to offering you the most high standards of health possible, or the studies that are out there, or the years of having those studies available to us and seeing all of the populations in the United States have the benefit of this health initiative. So.
Okay,
thank you for your time.
Thank you. Fluoridation is endorsed by the majority of dentists and other medical professionals and organizations, and these are reputable individuals, people many we know. They're our own personal providers. We've come to trust them. So many issues can be reduced to who do you believe and whether there are any unstated motives that might influence a position or another. What part does that play in this discussion?
I don't think it plays a part as far as believing studies that aren't anything other than what's here. I think what's important is that you believe who your local people are and who you trust. It's an issue of trust, and it comes down to, if you have questions about this, you go ask your dentist, or you go ask your medical provider, whether that's a physician or a PA, a healthcare provider can give you that information. And I think that's who you trust, and I think that's a common sense thing about what's happening here in Wichita and what's happening here in our state. And if this were really a problem or may cause these problems, we would be hearing about it already, and we're not. And unfortunately, it would be nice that we could enjoy the benefits of having the optimal level of fluoride, just like Kansas and Kansas City and Lawrence and Topeka, as well as our neighbors in Mays, El Dorado and Wellington. I mean, they're already enjoying that and benefiting from it. And we would just like to have the same opportunity here in Wichita.
How do you respond to the statement that we're in the minority in terms of not having fluoridated water, and these are, again, reputable medical organizations that seem by a high percentage to be calling for fluoridation?
All right. Well, first of all, we're not in the minority. If you look worldwide, we are in the majority. Most cities in the world do not fluoridate. Only a handful of countries, very few, 7 or 8, fluoridate their water with more than 50% of the population. My question is, this is endorsed. I mean, they show endorsements, but they don't show studies. And if they're looking for endorsements, back in the previous to 1930s, the American Dental Association, the American Medical Association, and the U.S. Public Health Service absolutely strongly opposed water fluoridation because of fluoride's toxicity. What happened was, back then when we came to the 1940s, we had industry pressuring, political pressure, to develop a new science showing that fluoridation has benefits. And this is a problem. And this happened even when we get into 1974, when the Safe Water Act, Safe Drinking Water Act was instituted. And then we come into battles, the ADA trying to remove fluoride from the federally enforced list of chemicals in the water, because it would damage the fluoridation program. And it wasn't until 1985 they just turned around the EPA against EPA scientist recommendations, against advisory council recommendations, which were going back and forth between 1 part per million and 2 parts per million for maximum contaminant level, jumped it to 4 parts per million. All right, this is not ethical science. All right, this is a problem.
The average person is hearing contradictory statements depending on who you talk to, what source you go to. How do you, as a layperson, begin to sort that out? You can't do your own studies, or you can't deeply investigate any of the studies that are out there. How do you begin to sort that out?
Well, as a matter of fact, there are studies out there. The thing about the Environmental Protection Agency is that they have a mandate from the federal government by law, the Safe Drinking Water Act, to make sure that our levels of all types of drinking water that are coming from the ground are regulated. So there are many, many studies. It's simply not a factual statement that there are no studies. There's over 3,000 reputable studies, and that's what their jobs are. And the FDA regulates the bottled water that we're drinking. The EPA regulates the groundwater. And when it gets up to a certain level, they have maximums. And when those maximums are reached, they come down like crazy on the water systems, using the American Water Works Association to make sure that those are safe levels. And there are so many actual studies that show that fluoridation in water has helped make teeth stronger. I just had an incredibly fortuitous example happen this morning in my office. I had a man in my office, been a patient of mine for years, who had just one little filling to do. And he said, I don't think I've had very many fillings. And I said, well, let me check. And I hadn't done a filling in 16 years. And he says, I think I've only had like 3. This is like my 3rd. And I said, this is the 3rd. And I said, where are you from? And he said, I grew up in a small area west of St. Louis, and we drank well water. So I checked on it. I Googled it, because I can actually Google. And I found that well water that he was drinking or in the area is 0.91 parts per million. And he was 50 years old, and I looked at him and I said, you know, you actually do have fluorosis. And he said, what's that? And I said, and I showed him these little white dots on his teeth, and I said, you can't see them, you've never actually been able to see them, but I can see them and it hasn't been a problem. But what it has given you the advantage of is you're 50 years old and you just now got your 1st or your 3rd little itty bitty filling because your teeth are rock hard. So there is a lot of benefit to it, and particularly with small children. We're looking at people that don't actually have, who I care about is the people that don't have the access to the fluoridated supplements and the fluoridated toothpastes as much as many of the other children in our community. And once it gets past the age of 8, well then it's not going to change anything anyway. It's just going to help make the teeth stronger just by the action of the fluoride in the saliva.
One of the other points of discussion that we've heard a lot about is what about choice? If we do fluoridate the water and there's a vote taken, there are those, for whatever reason, and whether you see it as justified or unjustified, who would rather not have their drinking water fluoridated. Is that a problem? How do we resolve that?
That's a problem. It's particularly a problem for minorities or financially deprived or disadvantaged people. That's in the cities that are fluoridated. Those are the very populations that continue to have a lot of cavities because fluoride doesn't stop tooth decay at all. I've already reiterated or told you about the statistics and the testimony by the American Dental Association, and the 3,000 studies that you keep pointing out are among the 3,000 studies or more that were found scientifically invalid.
That's incorrect.
That is
That's
incorrect.
not true.
Tell me
That's
what
an
is
incorrect
correct.
That I don't want to jump in over you if you want
That's
to.
fine. Go ahead.
That's totally incorrect.
Why do you say that?
Because you're wrong, and I
Tell
can't
me
go.
why. I'm going to tell you why
well,
I'm right.
you're interrupting me, and so it makes it a little hard to tell you.
Why is he wrong, and then why is you'll explain why you're right?
Because just because you say there might be a study that says those 3,000 studies that have been conducted over 68 years have all been rejected, that's totally untrue. If you can cite me to a study that shows you, then I would challenge you that that hasn't been peer reviewed, that hasn't been properly researched. And I will tell you, citing me to something that takes place in Europe has no validity here in the United States. Europe has a totally different program. They have more fluoride in their water. Actually, India has, what, 300 and some parts per million. The fact that they don't put fluoride in their drinking water is, one, they don't need it, or two, they have so many drinking water areas that they can't possibly do it, so they use fluoridated salt. But in the United States, We have every reputable healthcare organization, the ADA, the AMA, Centers for Disease Control. They all support this. And by virtue of the fact that you say that's not true, that common sense tells you that. We wouldn't be doing this in our United States if it weren't safe. We wouldn't be doing it in Lawrence, Kansas, Kansas City, Topeka, Wellington, Mays, if it were not safe. And did you know that in Dodge City, they don't need to optimize their water because they already have 2.1 parts per million that naturally occurs there. And we're not seeing any of these possibilities or any of these diseases. And I just really think that is misleading to the public because it scares them. And I don't think that's fair. I think that's why we need to look at what's done in the United States and what's done in our state and what's important for Wichitans. And we are entitled to have this benefit.
The study about the 3,000 people was performed by York University, which is assigned by the British health system to do scientific studies. They have the largest database in the world, particularly regarding health, but on all aspects of civilization practically. Those 3,000 studies had 3 basic criteria to meet. And as I said, only 25 met the criteria in regards to whether fluoride prevents decay or not. 25 out of 3,000 plus. Those studies met only one of the 3 reduced criteria that is called the National Institute of Health Research. They met only one of the 3 criteria that they had set up to be a validated study under reduced conditions. In regards to everybody does it, everybody used to think the world was flat too, and if you drove off the end of the ocean and didn't come back, that proved it.
Well, with all due respect, Doctor, really you can cite me to one study of someplace, excuse me, one study over in England, and you're talking about the United States when most of Europe comes to the United States for the answers, and you want to challenge what we do in the United States based on one single study done in York, England. I disagree with that. I think that's misleading. We need to come back to what's good for us. What's good for us in the United States as Kansans, as Wichitans, and we need to stick with that.
We may have been very hopeful to think we could accomplish as much as we want in this short period of time, but we do need to keep on target with and give you an opportunity to make a closing statement and make the statement you want to leave folks with. And you've got 2 minutes to do that. I'm going to ask you.
Don't I get a chance to answer this business about the York study?
If you can include that in your closing statement, I'll ask you to do that. Dr. Hinshaw, go right ahead. Thank you.
Okay. Today we have discussed the total ineffectiveness of fluoridated water in reducing tooth decay. This lack of efficacy has been admitted in documented testimony given by the American Dental Association and by documents from the British Ministry of Health, and aptly and abundantly confirmed by the World Health Organization. How long will it be before the proponents of fluoridation admit that fluoridating the public water supply does not reduce tooth decay? How long? Today we have discussed only a few of the many dangers of fluorides. The York study was 3,000 people, or 3,000 studies. Basically their database includes world literature, including the United States. And there's no bias in it. It's one of the most blue ribbon studies that's ever been done. And I told you, it does very little, almost nothing, to support the case of effectiveness for fluoride water.
Got about another minute, and you need to share that time with Dr. Lamadou.
Go ahead.
Well, I think people are the same worldwide. Just to discount people in another country, that is ridiculous. The point is, we have these studies all over the world. How come they're not doing them in this country? We have over 39 studies that show fluoride reduces IQ in children. And to say that because these people are from China, it's not applicable, that's ridiculous. You're talking about 2.1 parts per million of fluoride like it's something natural? We don't know. Is that from pesticides? We don't know. All right? The point is that people are the same worldwide, and fluoride is toxic to everyone. Thank you.
Well, we do know. And as a matter of fact, I'm sorry, you know, that you don't. I am not discounting anything. As a matter of fact, you mentioned places over Europe, and it could be that their fluoride, for example, in India, is like 300 parts per million. It's different than 300 parts versus less than 1. So I respectfully disagree. We're a great country. We need to follow what's done in the United States. 68 years of research, over 3,000 studies. I'm sorry, but I mean, to cite to one simple study over in England, that's just not going to be persuasive for me. And so I want to say that this is being done here. It's supported by the AMA, all reputable health organizations. We are doing it in Kansas. We are doing it in Mays. We are doing it in Wellington and El Dorado. We can just look around. If there were all these problems and it was so toxic, then we would have a terrible, terrible epidemic, and we just don't. And so we need to let the Wichitans know that this comes down to a simple, common sense decision. And if they still have questions, then they need to go ask their dentist or their lawyer. And this is not just about efficacy and cost saving, it's about quality of life. And think about it, wouldn't it be nice for everybody to have dignity with their smile and what they eat? And I present that's priceless. And so I would like for everyone to join me on November 6th to vote yes to optimize our fluoride from 0.3 to 0.7 parts per million. And this will benefit everybody. And I thank you for your time to advocate for fluoride.
We'll direct folks to WichitansForHealthyTeeth.com, purewaterwichita.org for additional information. I know folks will want to continue to do their research. Again, thank you to all of you who have joined us. Representing Wichitans for Healthy Teeth, Wichita attorney Pamela Ammar and Dr. Rob Dakin, a local dentist. And representing Pure Water for Wichita and opposed to fluoridation, Dr. Charles Hinshaw of the Reardon Clinic, and Dr. Stephen Lamadou of Advanced Alternatives for Health. A lot of discussion to continue. We've got some time between now and November 6th, and I hope voters will do their best to do their research, talk to folks they trust, and we'll have a decision on November 6th. Again, thank you for your time. That's our program this evening. Thank you.
Thank you.
Thank you.